They would always be like, can you come home with me? And I think I recognized, so I was always that nurse that kept a book of all the things that, like, why are we doing things this way in healthcare? Why can't we do this better? Have we thought about this? So my mind was always racing about all the problems because they are abundant in healthcare. And this was one where I knew I was going to leave to build this. So I was super intentional about sitting and talking to my patients in the hospital for probably about 6 months before I left. And I would start to talk to each of them every day and talk to them and just to listen about what sort of support do they really have and what are they afraid about it. All the things, do they wish that they had someone else that they could talk to, or did they wish that they had someone else to rely on, whether it was the patient or the family member themselves? And, my patients would always like tug at my scrubs. They would always be like, can you come home with me? Can I pay you to come home? And you can't do that in hospitals, right? Like, it's against policy. And I remember one day there was a nurse on our floor and he was actually fired from the hospital because he actually went and helped to take care of a patient that we'd had in the hospital at their home. And like, it's like a big deal to just be hired independently. Now we're creating a way that nurses can actually work for an organization that allows them to care for their clients at home. And it's beautiful because then they've cared for them in the hospital and they care for them in their home. They know everything about them and their patterns and their behaviors and what worked and what didn't. They know their entire medical history from the hospital, and they can help bring that into their home and into their community and connect with their current providers and their networks, just knowing everything.